Thanks for tuning in to Written on the Edge, Season 8, Episode 2. In this week's episode, we'll be discussing Crisis and Care with one of the contributing authors, Emmett Patterson. He's going to share his perspective as well as his contributions to the book and what he knows of the book in general. Then we'll be continuing our review of Sense8, and Baz has an announcement about some upcoming stuff with that. Albert Nothlit will be joining us as well, and he's going to join the upcoming stuff with that. But we've broken this episode up into chapters so you can jump to your favorite part if you're busy. So let's get on to the interview. Emmett Patterson is a longtime queer and trans health activist, project manager, and writer. He takes a global, community-centered approach to his work, having organized with activists in the Middle East, North Africa, Latin America, Eastern Europe, and the United States. Emmett studied public health and gender and sexuality studies at American University and earned a graduate certificate in LGBT Health and Policy Practice at the George Washington University. He attributes his He attributes his commitment to sexual health and liberation for himself and others to the wisdom of a lineage of HIV and AIDS, racial justice, and disability justice activists. Emmett, welcome to the show, and I apologize for tripping over my own tongue.
All good. It's definitely, alphabet soup for sure. When you just start throwing in public health terms as well, it's just off to the races. But, thanks for having me. I'm really excited to be here.
Our pleasure. So let's talk about where you got your start on this amazing journey.
Yeah. When I was kind of thinking about what really got me excited about writing, and then, particularly what got me excited about writing about, queer health and public health, I always have to kind of go back to my own lineage. I grew up in southwestern Pennsylvania. My parents have been working in emergency medicine for about 40 years each.
Wow.
And so my mom's an ER nurse, my dad's a paramedic. And, I really grew up in those spaces. I spent a lot of my time as a kid in, the hospital break room or in the back of the ambulance garage. And, weirdly, what I kind of saw in those spaces, and also just in how my parents kind of interacted, with each other, when we're eating dinner together, was really a lot of storytelling. And I thought it was just really fascinating how that kind of showed up consistently, and of course I didn't realize this as a kid, but, in looking back, I realized how much of the way that they could share about their experiences of, health and wellness in the world was really centered around storytelling, telling the story of something really awful that happened and how they fixed it, or something that was really difficult. And I also saw this, kind of like almost like a generational passing of the stories, as like a way of training, as a way of kind of bringing up new emergency, frontline providers. And so I got really interested in like, storytelling is such an casual part of this like unofficial training. And when I was, kind of ending my, my undergrad degree, I was in, kind of a thesis program, and they said, all right, what do you want to do? And so at that time I had been really interested in, training up healthcare providers to care for trans folks. I am a trans person. I, came out right before I left high school, and I have faced just so many barriers to getting affirming and really even getting in the door of healthcare services at that time. And I've watched a lot of trans folks my age now die very early because they weren't able to access care. And so that's kind of where I was headed. I was like, all right, well, how can we like convince healthcare providers to care about us, to learn about what we need, to listen to us? And so I kind of was going the very like formal training route, like this is the module. And then I started remembering the stories that I would hear from my mom and my dad, and the stories I would hear when I was in the hospital or at the ambulance garage. And I realized storytelling is its own way of teaching. And so I scrapped at the last minute this training module for my thesis, and I started writing short stories from trans people's perspectives in emergency medicine. And so I wrote, it was called Prick, and it was really about, just the experience of trans men, particularly going through an emergency scenario, and how to communicate what we need and what our bodies need in that moment. So that's really where I think kind of jumping off where like health and storytelling and my transness kind of started to intersect.
Nice. So let's jump to where you were approached to contribute to Crisis and Care. And
Yeah.
let's talk a little bit about what the project's focus is.
Yeah, absolutely. So Adrian Shanker, the editor, and I know each other. We both went through the LGBT Health Policy and Practice program. That's where
Okay.
I kind of took Prick and took it to the next level and started to do some evaluation where I would actually send it out to ambulance garages and ERs. And I would say, hey, if anyone wants to read this and kind of do a pre-survey and a post-survey about how this might have changed your perspective, let me know. And so I think Adrian kind of saw that little spark of this is somebody who's like really thinking about using stories and narrative to change thoughts and minds in healthcare. And so, yeah, so we have had a friendship really since then. This is the second book that I've contributed that Adrian has edited.
Nice.
The first was really about queer health throughout the lifespan. That's Bodies and Barriers.
Mm-hmm.
And for Crisis and Care, particularly, I think what was so interesting was writing really at the beginning of this pandemic and now being in it 3 years later, being able to look back and see that actually a lot of this is still very true and ringing very true and feels very contemporary. Um, and so when it came to Crisis and Care, Adrian approached me specifically to write about sexual health. That's really been, kind of my way in the world. Like I said, sorry. Like you said in the intro, I've been involved in HIV justice work. And so naturally, I just have become kind of like the go-to sexual health person. Like, okay, who do we know who can, talk about fisting in the same breath that they can talk about like HIV treatment in the same breath that they can talk about like orgasming. And so, so there's just like, I've become that person. And honestly, it's an honor. But at that time, I was also working on public health work at Grindr, the dating app. And there was definitely, I was doing quite a bit of work around getting the message out globally around how to still connect as queer people safely during this time where we didn't have a lot of information. So that's kind of how I got brought in.
Nice. And I do want to say thank you for approaching that with open honesty, because your essay actually starts out with the start of the pandemic and you're like, oh my God, got to put my poppers away. What the hell's going on?
Exactly.
And so I just wanted to say thank you for approaching it the way our lives are, just the way they are, and with what is needed for our very different bodies.
Absolutely.
And the way our
Yeah.
community aligns too, so.
Right.
Yeah, definitely. I think for me, there's really never been the option of holding back. Just have to kind of like move forward. And, I also say that, again, like as a trans man, I think that there aren't a lot of ways in which, we get to, first of all, just tell many of our stories, but also especially the stories around like our sex lives and our queerness. And I think for me, that's always been, even though I tend to be like kind of on the private side typically. I think in my writing I'm much more forward because I know that this is something I would have liked to have read. I've actually been recently reading the Lou Sullivan Diaries, and
Hmm.
Lou Sullivan, really one of the founded FTM International, which was like kind of the first organized like transmasculine organization, very publicly was queer and actually died of complications related to AIDS. And so definitely a transcestor that I feel in reading his diaries, I had to really put them down a lot because they were so sexual and also so innocent at points. And so for me, that kind of writing is really powerful. And even though I might be poppering it up and coming at it a little less innocent, I think that that's still like that explicit kind of, I really don't know what's going on. And I miss this thing, this pleasure that I had. That's really important to me. And it was particularly important in this chapter, especially at a time when people didn't know, could we keep dating or fucking or connecting with each other?
Well, so let's jump into some of the LGBTQ specific health challenges that sparked the idea for this book.
Yeah, absolutely. Of course, like I think a lot of times LGBTQ health gets siphoned into sexual health. I think sexual health is a huge important component. And as this book shows, there's so many more components of queerness and how public health crises can play a role. There were definitely components of this book that really talked about the need for LGBT health center, or sorry, there were definitely components of this book that talked about the need for physical space. So LGBT community centers being a really important role. There were also really pieces around tracking kind of gender identity and sexual orientation data. So when we think about crises, we need, you have to be counted to count. And so if we don't know if a public health crisis is affecting certain communities of people versus others, we can't distribute resources, we can't message correctly, we can't, protect people and give them accurate information. And then I think, of course, there were absolutely pieces around distrust of public health systems. I mean, if we look at our history, systemic violence is very much at the root of a lot of the activism that has sparked queer justice, HIV justice, racial and disability justice. All of these things for me and for so many others connect together. And so when we think of, the CDC response to AIDS in the early days, and the ways in which activists had to push from the outside to actually make that change. The change did not come organically from the government. It came because people died, put their bodies on the line. And so there absolutely is, especially in crisis and care, when we're thinking about COVID, we can't just see queer justice and queer activism and agitating as its own thing. Kenyon Farrow has a great essay in here about, particularly when we realized that COVID was disproportionately hurting Black Americans, we really have to contend with also the racism of these systems, of public health systems and medical systems. So yeah, I think that this book is definitely pieces of various parts of the movement, some of the essays being very personal about mental health and solitude, and how to find solitude in your queerness, and how that can be protective when you're literally physically isolated from people. And then, yeah, it goes all the way up to, these are the systems that are currently in play, and we have to break them down.
One of the things I appreciated is it's a book both for healthcare professionals, just to help wake them up, open their eyes, but also just as a queer person who might need healthcare, it gave me some language to use.
Yeah, absolutely.
Which was brilliant. I mean, the brilliant approach to both sides of that issue.
Yeah.
All right.
So I have a
so let's
question.
highlight some.
I have a question. In your path through all of this, do you find that technology and platforms assist in outreach to trans people that are not necessarily in big metropolitan locations? Or do you find that it's still an area that we must focus on because the accessibility, while possible, may not be as strong as it could be?
Yeah. Sidebar really quick. Sorry. Of course, I'm talking too much. All right. I mean, yeah, that's a great question. I think as somebody who formerly worked at a dating app, as somebody who currently works with dating apps still in a different capacity, we have to utilize technology, but not be completely resigned to it. I totally believe in a tech and analog perspective. I think we've seen that as HIV justice movements and HIV outreach continues through this day. When I think of pandemics that are affecting queer people right now, I'm thinking of not just, the COVID pandemic, the monkeypox virus pandemic, which I'm happy to talk more about, but also, of course, the ongoing HIV and AIDS pandemic, and as well as the overdose crisis. These are all kind of things that are co-occurring, and we can really benefit from tech because tech allows us, and when I'm saying tech, I'm really coming from a space of dating apps. I think that this is kind of a natural place that trans folks are part of, especially, those of us who are from rural communities. I think had I had the kind of mobile tech available to me at the time when I was coming out as trans, I think my life could have been very different. I might not have felt as isolated as I did. But I do think that particularly spaces that are about queer intimacy and connection, people just try to shorten into sex apps. But I think they sometimes are that and more. I think that these are definitely places where there's both opportunity for, trans people to get connected to resources like HIV self-testing, or information about, what's happening in their area around, trans exclusive or laws that might harm trans people, just kind of getting that information out, but also just as a way to really just show you that there are other people around. So yeah, I don't know. Does that answer your question, or was there kind of a
Well,
component that I missed?
the reason why I'm bringing that up is I'm even thinking beyond like our typical community apps that we use, but I'm thinking like even, healthcare systems that have portals, patient portals and stuff. It seems to me that we're even in metropolitan areas. I'm here in San Diego, California, and I know my portal doesn't have anything that shows for queer people that for a specific kind of care that could be needed. So I was thinking, not just within apps that we typically use as a queer community, but I'm thinking even like more mainstream outreach to where that those healthcare professionals have, maybe a place where they can, include that so that there's a link to other resources and stuff. So I'm wondering, as a community, maybe one of the focuses we could do is to look in that direction to try and gain some space in that area. You know what I mean?
Yeah, I think I am getting what you mean. I think that again, this kind of goes back to this idea of, do we cache these kind of resources in systems that aren't run by us, right? Or
Mm-hmm.
don't typically kind of aren't built with us in mind. I think that there's definitely been some radical work being done at that very like non-sexy level of, electronic health records being much more inclusive. But I also do see that there is a need for, when I think about, again, like queer health, trans health, it's healthcare for queer and trans people. It's not this siphoned set of resources. So I think one example that I can think of that was actually a really great way to both do tech outreach, analog, bringing community resources into people who might not otherwise have them, is actually a project here in DC called One Tent Health. And what they do is they set up a tent outside of a grocery store, a laundromat, a car wash, and they actually do HIV testing. So they do HIV rapid testing in kind of like private tents. And what I love about it is it's not just HIV testing, it's many types of things. And they grew during the coronavirus pandemic to really add in COVID testing. Was one of the things they do. And now they're actually doing PrEP onboarding as well on site. So they're
Great.
going into places where people don't have, easy access to those systems. And they're saying, hey, this is free. You're waiting 45 minutes for your laundry anyway. Come on in. And they did a lot of outreach through Grindr for Equality, which is the team I used to work on at Grindr. So you got that mix of, on the apps, you would get a message if you were in this particular area of DC that said like, hey, we're going to be, at the Safeway at this intersection, come through. And then you just naturally get the people who would come, out of the grocery store and say, oh, great. Like, I've been wanting to do this, or I've never done this. And so, yeah, I think that there is this need to particularly think about how does tech and IRL work together to support each other. And, when I was thinking, when I was reading through my chapter again recently, I was just really thinking about this way that often queer people have to horizontally teach each other about what our bodies need and what's available and what's safer versus not as safe. And especially during COVID, one of the examples I can think of where tech again kind of came up as a not necessarily a physical health resource, but very much a mental health resource, was Club Quarantine, which was kind of, I think Canadian DJs started just doing a virtual rave every night. And they were like, we will do this as long as the pandemic is going. I haven't checked in recently because it got tiring. But it was what I loved about going to that space was everyone was in their own little Zoom box, and they had the shared set list was going, and you would see older people, you'd see people with kids, you'd see people like me who were disabled and immunocompromised and couldn't go into a physical space, and it was really beautiful and super fun. And I think hearing from people that said, I love going to clubs, I love dancing, but they're just not accessible to me. And so for me, that's kind of where this mix of, kind of reaching people who are, or reaching people who are, kind of outside of city centers who are queer and trans comes together with a lot of what disability activists have been doing for so long, which is thinking about how do we bring everybody into the space who physically can't be here. Does that? I hope that kind of makes sense. But I think, yeah, the rave was definitely one of the ones where I was like, this is super rad.
That is
and this
I
is
love
public
that.
health. This is absolutely about mental health. This is
Yeah,
about
absolutely. I
connection.
love that.
So that's a great example of resiliency. Can you give us an example of some activism that happened during the pandemic?
Oh my gosh, it's just like we do not have the time. But I think so much of the particularly activism that was couched in queer spaces, I think, especially at the early days, was a lot of folks who were, particularly in HIV movements, were trying to make comparisons, not in a way to eliminate the history of the HIV and AIDS pandemic, but really to say, hey, we've been through pandemics before. This is how we did it. And that wasn't just around sexual health and queer connection. That was around stigma. How do we talk about COVID? How do we talk about who gets COVID and why they get COVID? And so I think a lot of the activism, especially in the early days, was trying to reach back into our history and think about how do we not make the same mistakes, or how do we learn from those mistakes, and how do we actually talk about this. I think another example of that did have to, again, I'm a sexual health person, I gotta like
Go
feel
for
my
it.
vibes
Yeah,
here.
yeah.
Was really, watching, Dr. Dimitri Daskalakis, who at that time was, at New York City Department of Health, who's now the current MPOX, one of the MPOX leads at the White House, was watching Dr. Daskalakis really come out swinging with, being a person who was very heavily involved in the New York City Department of Health guidance on how do you have sex in COVID. Being a person who, as I mentioned in the chapter, showed that you can make a face covering out of a jockstrap, and that glory holes are actually pretty COVID safe, at that time, and the way that we kind of were understanding how COVID was spread. And so I think, again, that's another great example of somebody who is unapologetically queer, really shaking up an institution that needed shaking up. And so I really appreciated that level of activism as well. And then I think, if I can kind of even bring us forward, obviously, into the state that we are now, I think what I'm experiencing, as somebody who's been involved in HIV activism and queer and trans activism and justice work for a long time, is that disability justice is not very understood or really imparted into our movements. And what I mean when I say that is that as a disabled queer person, I feel like the queer and HIV specifically movements have left me behind, and have left so many of us behind, and have started making those same mistakes. And so what this looks like is, convenings and conferences where people organize and push for, policy and connect with each other, got rid of mask mandates, and that effectively blocks many people, including some people living with HIV, elders in the movement, Black and Indigenous and other folks of color, who are still at the highest risk of COVID harms. So it not only becomes a disability justice issue, it also becomes a racial justice issue, and of course, economic justice as well. When we think of how healthcare systemically interacts with who we are, how much money we make, where we're from. It's been very shocking to watch this exclusion take place, and to watch, these HIV and queer leaders say, nope, we're digging our feet in, over something that, could be very much seen as harm reduction, around masking. And so I think what I've been seeing, especially in the last few months, has been really disheartening. And also, I am relatively new to identifying, as disabled. I kind of transitioned into disability right at the start of the pandemic. And so I'm still also learning how to have that rage about how ableism is so apparent, even in these spaces that should feel like, like ours, because we're part of them. And also, these are movements that purport to support, bodily autonomy and safety and solidarity. And that's just not happening, particularly for disabled and chronically ill folks at this point. So I will say that the queer activism recently has been very lacking for me. I think that it definitely has felt like, okay, like we like every other type of justice, but maybe not that one. Or, oh, but we can't have masks because then that reminds us of the pandemic. And I really do appreciate that there are writers who, including myself, who are writing about this right now, coming, both from kind of like a disability perspective and a queer justice perspective, about the pandemic is not over and queer people can't pretend like it is. And so, yeah, that's kind of where I'm standing on activism these days. I'm definitely leaving a lot to be desired.
So how can we invite those decision makers into the conversation without looking like the white knight charging in to defend?
Yeah, absolutely. I think part of it is really understanding that this is a long-term thing that we have entered into. So when it comes to COVID particularly, this is something that is going to be with us. We had a chance to potentially stop it. We now have to accept it's living with us, but accepting it lives with us does not mean throwing our hands up and saying, well, we're not going to do the things that we did in the early days. I recently went to my clinic, my sexual health clinic, and they had removed the mask mandate without telling anybody. And so I get in there and I am talking to one of the staff members, and they said, well, we decided because, all these things like RSV and flu, they've always been transmitted, so why would we wear masks? And so then I said, oh, so we should just like stop PrEP and condoms and HIV treatment because, there's always stuff out there. And
Right.
they did not like that. But what I meant by that is, that's really where my anger simmers, is that I don't like to make comparisons between movements and experiences, but honestly, like that's really what I'm working with here. That's trying to find the way to say, but do you not see how you're contributing to harm in the same way that harm was contributed to you? And so when I think about inviting in leaders, decision makers, people who have social capital in these spaces to make these decisions, is in order for us to connect and convene and organize, we have to keep ourselves as healthy as we possibly can. For me, it was really shocking to see a research study that came out, I believe, in October, that showed that people living with HIV are 4 times more likely to develop long COVID, so more likely to develop disability throughout the rest of their lives than people not living with HIV. And the fact that that is very understood and shown, and you still have movement spaces in HIV particularly that are saying, well, as long as you're vaccinated, you can come in. It both feels very anti-science. We know that vaccines are not necessarily the most effective way to prevent COVID. They are part of the toolkit. They are very effective at preventing severe illness for many people, not necessarily immunocompromised people like myself. But to me, it just feels like, why is masking the one that we can't do? It's affordable, it's cost effective, and it's relatively low barrier. And there have been, again, I don't want to say like, oh, every organization is awful about this, but there have been organizations like the Netroots Nation Conference, has a very comprehensive COVID strategy, and they explain why each component is there. They say we do universal masking at all indoor events because of this. And so it's both that explaining it to people, because I think that there's also been so much I'm going to say manipulating of the data from government sources like the CDC at this moment. And so when I'm saying that, what I mean is, the CDC right now says, here's the community level of COVID. And people will see a map that's mostly green, which means like, everything's fine. But what community level actually means is, will you be able to get a hospital bed? But if you look further down the page, there's the community transmission level, and it is red and orange. And so that means that the COVID is transmitting substantially and highly in most of the communities, 98.5%, I believe, last week, in 98.5% of the US. So I'm throwing all of this like data out there, right? This is kind of how I've approached these conversations with these leaders. And at the end of the day, the data doesn't seem to be, necessarily pushing people into movement or action. And so I come back to narratives. I come back to storytelling. And so I really think that it's important for folks like myself, who, again, have been involved in queer health and justice, and who either are disabled, are at higher risk because of their job, or, have a family member who's at higher risk. I really encourage us to continue to really just say, this is not okay, and this is how this experience feels. I just spent my third holiday season in isolation. So I think that there's a lot of anger, and I'll speak for myself. I'm very angry, and trying to express that is very challenging, particularly to people that I thought would, quote unquote, be on my side, or who would understand or be in solidarity with me. And so, I think that there has to be that mix of storytelling, as well as, again, interpreting the science and the data and the ways we know how to protect each other.
Well, let's get crisis and care into more hands.
Yeah, absolutely.
Libraries, hands, clinics, on the desks of elected officials. Let's get it out there.
Absolutely.
Anything else you want to say about the book or your current level of activism for the world?
I would just say that this is a particular moment in time when we can really start thinking much more across solidarity. I've always really envisioned a movement for health justice that kind of goes outside of these kind of siloed ways that we've done it. We have reproductive health, we've got HIV, care and justice, we've got trans health, we've got, environmental, health. I dream of a movement that is full of queer people and folks of color and disabled people and immigrants and migrants really agitating together around this idea of universal health and community health. And I think that COVID and the next pandemics will continue to show us that this kind of cross-movement solidarity is needed, and that we shouldn't be afraid of it, and that we shouldn't dig our heels in to doing things that we know cause harm to each other. And so, I would say in terms of crisis and care, give it a read. I think that there's definitely something in here for everybody, whether you're new to, public health, or new to queer justice or racial justice. There's definitely something in here for you.
And they're all stories. It's not a scientific diatribe.
Nope, they're all stories.
So what's up next for you?
What's up next for me? I think this is a great time to think about this as, as of this recording, it's been a few days into the new year here. This is a year of survival. I think for me, survival can sound pretty defeatist, but I think the fact that I'm still here as a person who's very high risk for COVID is really not a testament to me or my immune system, certainly not, but it's absolutely a testament to the disabled people who continue to love me into existence, and the folks in my life who are non-disabled, who are really stepping up and showing up in ways that are supportive and safer. And so I would say, like, I'm trying to survive. And I am also working on developing a private chef business. I have been, again, the pandemic has really ignited the fire in me to cook a lot of earthy foods, as I mentioned earlier. And I am interested particularly in working with folks going through what I call flares. So in chronic illness land, a flare is when your symptoms flare up out of stress, out of a trigger. So it's called Flare Chef. And it's for people going through flares, whether that's a chronic illness or something in your life that's happened, like a death or a new family member being brought into your space. You're going through substance use recovery. I want to make sure that people can eat well and also feel confident in the kitchen, and find ways to also make the kitchen work for you, physically adapting recipes or your kitchen setup. So I'm still trying to figure out what that looks like, but definitely excited to bring food kind of into this world of justice work that I've also been lucky to be a part of.
So where's the best place for people to follow you and these updates? Because this is the first I've heard of the Flare Kitchen.
So I definitely am public on Twitter. I'm private on Instagram, but you can go to Instagram at Flare Chef and see how the sausage is made, quite literally. And yeah, so that's where folks can find me.
Perfect. Any final words of wisdom?
Nope. That's all I got for you.
All right, folks, we'd like to extend a huge thank you to Emmett Patterson for joining us. Thank you, Emmett, so much. And thank you for jumping in last minute. Oh my God.
Yes.
Yeah, absolutely.
Lifesaver.
Thank you for having me.
All right, folks, let's move on to our review.
Hey everybody, so we're here for the second of our review and chat and discussion of Sense8 for Queer Sci-Fi Month. And Vance is deemed to join us again. He's back from the netherworld of the sick.
Hello.
All right, so what do you want to add, Vance? What are you thinking of the episode? Because they've heard what Albert and I have talked about, and we're going to cover episodes 4, 5, and 6, which are, I have my little list up. What's Going On, Art is Like Religion, and Demons. And we'll kind of just do each episode a quick discussion of each and what we felt about it and how it moves the story forward, and what do we think about what's going on with the queerness in these characters. And episode 6 was the big one when it hit because of the orgy scene, and that was like blew everybody's minds when they did it. So we'll get into that discussion when we get to episode 6. So Vance, what are your thoughts?
I personally hate coming to a show years after it's been released. And it's my own thing because everybody's already talked about it, so I've got some preconceived notions. But also, Sense8 was sort of a pioneer on the science behind how their stuff works, but then it was picked up by Discovery, and all of a sudden I'm like, you know what? I'm kind of sick of the mycelium network. So I know Sense8. I know Sense8 was on the forefront of that scientific trope, but I'm seeing it at the tail end, and I'm just like, okay, we've seen this before a couple times now. Give me some new science. That said,
yeah, but that's not really judging it on its own merits. Sidebar, does somebody have a speaker running? Because I can hear feedback of the speaker.
No, but wait, maybe it's me. Wait. Is it better? Like, I'm going to mute this? Look.
Yeah, I don't hear it now.
Okay, so it's probably me then. So I'll keep myself muted here externally, and then I'll just unmute when I speak.
Okay, you're not hearing it through your earphones?
No, I'm not.
Oh, okay. All right.
So click on the settings button and check to see if the output is going to your headset as opposed to your computer speakers.
I hear it. Let me see. Settings, speakers. Yeah, the microphone and speakers are here.
Huh.
So that should be okay. Let's see what else. Yeah.
I have the
So
buttons along
I'll
the
just.
bottom where it says mic, cam, speaker.
Yeah, same here. So I'll just. I have an external mute button here, so I'll just use that to prevent any feedback and just unmute myself as we
Okay.
go along then to prevent that.
Okay.
Yeah.
All right. So back in on sidebar. So I understand your point, Vance, but it's like,
But I'm wrong
hate
because
to
you want to tell me I'm wrong. So
no,
let me
no,
stop.
it's not that.
Stopped interrupting me. On its own, it is a beautiful, complex, slow build of a story that I can see why you love it, because it gets into everybody's heads.
Well, it plays with the thing that I love most. Perception.
Exactly. It does. 100%.
Yeah.
I actually haven't seen that many other shows that have this mycelium.
Yeah, I don't know what you're
dimension
talking about either.
as-
Okay. Moving on. I'll sit here in my little wrong box.
You're not wrong. I just don't understand it. Okay, so let's talk about episode 4, 5, and 6, because that's what we're here to talk about today. So, Albert, your thoughts on episode 4?
So that was, I think this is the first episode that is not directed by one of the Wachowskis, which I found interesting. I was like, as I was watching it, I kept asking myself, can I see any difference between 4 and 1, 2, and 3? And the only thing I kind of noticed was that some of the transitions were a little bit more confusing, particularly with the montage when the song is going on, the song by Four Non Blondes. Some of the transitions were a little confusing for me. Other than that, I didn't notice many differences in direction. I don't know if you guys noticed anything.
I did a bit.
I didn't notice the transition oddness as much, but I think you're right, because I was still trying to figure out, by episode 4, I was still trying to figure out who was what, where, how are they connected, what's going on. I mean, like I said, it was a slow build of a story. So still in episode 4, I was just finally identifying each character's place in the story. So I wasn't paying attention to the production aspects at this point.
That's interesting. So, Vance, did you find yourself connecting with any of the characters particularly? I mean,
No.
watching? No, not yet. Oh,
No, not at that point.
it's really interesting because, like, Vaz and I were talking last time. I really connected with Nomi right from the beginning. I don't know, like her story really resonated with me for some reason, and Baz really likes Lito, so that's interesting.
Yeah, Lito and Nando, they're my favorite characters.
Yeah.
I didn't put them high on my list of favorite characters until about midway through episode 5.
Who? Which ones?
Lito and Nando.
Oh, okay. I think what I love about it is that not only is it the different aspects of where they are in the world, but the cultures they come from play a factor. And it gives you the ability to find the common threads in these different cultures that still speak to the human condition. And this is what I think makes this show so accessible in many respects. It is a slow burn, but the payoff when you start getting the answers are enormous. I mean, it really, I can understand, although I still don't know which shows you're thinking of that do the same thing, but what I loved about this, when we get to the point where you actually have the big revelation of what it is, there is a element of, oh, maybe this could really be going on and we don't know it, kind of thing. And that maybe, what some people may determine as mental health, which is with the whole situation with Numi going into the hospital and all of that stuff, and then dealing with her mother constantly dead naming her, and all of those kinds of things coming at her. And then at the same time, she's dealing with the fact that she's seeing Jonas and she's seeing Angelica and she's seeing, so I liked that it's, not to use a metaphor that's appropriate right now, but it's kind of an onion skinning of these characters. You're diving deeper and deeper and deeper into them.
Mm-hmm.
Yeah. And I think we're also seeing kind of hints of the greater narrative. By episode 4 in particular, there's this scene with Sun when she's speaking with her dad and her brother, and they mentioned that like her brother was embezzling funds for a pharmaceutical company, and there's this thread about pharmaceutics, and many of the characters have kind of connections to that. So, like, I don't know, the writer in me is like, ooh, maybe this is leading somewhere. Maybe all of them have a connection. Because there's like, Capheus is representative of the people who are affected by fake drugs, for instance, right? Like his mother. And then there are these other people on the high end, like Sun and her family, who manage the funds for those things. And Kala, I think, works for a pharmaceutical company. Yeah. So I don't know, like many of the characters are connected to this. I've only seen up to episode 6, so I don't know. But I think in episode 4 is where you kind of start getting that.
Yeah, that's a really interesting thought. I'd not put that together with the drugs, and it actually, now that you say that, there is an element of that all the way through, and so that's interesting. It had not occurred to me that thread was present the whole time. I just kind of wrote it off as just part of society, but in a way, it plays a factor because they're all connected through this hive cluster that they have.
Yeah. And drugs are mentioned at the very beginning. Angelica is trying to hide from like the bad guy using drugs.
Whispers.
Yeah. And like Riley is also expanding her mind with drugs. So there's, I don't know. I've seen it a lot over these first few episodes. So that, I don't know. It was something that caught my attention right away. And by the way, I loved that scene with Sun and her family. The way it was filmed, it was incredible. Like you could see her father's shame at what his son had done and Sun's bravery. I really like that. And I find myself connecting a little bit more with Sun now because of this narrative.
Yeah, and the fact that she's probably the strongest individual in her entire family, and the fact that her father has to own up to that.
Yeah.
Mm-hmm.
Okay, so anything more on what's going on?
Not really. Okay. It was nice. Yeah.
Okay, art is like religion. Episode 5. Thoughts?
So this is, I think it's where I began to ask myself how the connection, like the sharing of experiences and memories actually works. Because there's this scene between Capheus and Riley when Capheus asks for permission to drink some tea, which is on Riley's table, but Riley isn't drinking it. But Capheus says that it tastes sweet or something. So I found myself wondering, like, so how exactly is he experiencing that if she's not experiencing it at the moment? That, I don't know. Mm-hmm.
It's kind of like the memory of her having had it.
Maybe.
Yeah.
You know, but that's in and of itself is a little different than what we've normally seen in shows where people have shared concepts, shared kind of mind hives or what have you.
There's a scene later between Riley and Sun where it is specifically described as a memory. Sun tastes something from Riley as a memory.
The thing I liked about this episode is the sequence with Leto and the man who's pursuing Daniela. And you get that whole sequence where they're having a meal on the set, and he begins talking kind of crazy about how to kill a man and blah, blah, blah. And it's not really 100% clear that he's the guy that Daniela is running from at that point, but it becomes much clearer, and it actually plays a factor in the end. And what I love about it is that Leto's entire career is built on this action star kind of thing.
No, when the guy comes up to him, like right away, introduces himself in such a way that it's clear.
No, I know, but I mean, it's not as clear to what degree it is, because you get some of that later. It's not like that's not the end that you see of him. It will be back. Mm-hmm. But what I'm saying is that I liked that the dynamic that Leto is this big action star. He's this big, heroic Albert Schwarzenegger kind of character in Mexican cinema. And yet he's probably the least like that character in real life. And that, I think, is one of the things I love about the show, is that because of the sensates in their cluster, they learn to grow from the strengths of the other sensates within their cluster. And I think that that's something that they're learning to plug into. I also think it's interesting because in certain sequences, depending upon their emotion at the moment, they connect with a different sensate. I like that aspect of it too.
True, but there are still some favored connections, like Will and Riley.
Oh yeah. Well,
yeah.
Again, that's an emotional connection of some sort.
Yeah, this is actually when I began to wonder if they are actually going to show us. I may be wrong, but I think there are like 20 possible two-person combinations in a group of 8. So it's like, will they explore all of those combinations? Because it seems like a lot. I don't know. And like you said, Vance, there are some people that appear together more often. So like Wolfgang, for example, and Kala are like a lot together. Maybe there's a deep connection between them, but this is where I actually began to see the complexity of the show, because it's so many characters, so many connections among them. And I think episode 5 specifically must have been crazy expensive, because we have this big action scene with Lito, like when they're at the Museum of Art and everything is exploding. It was awesome to see it kind of from another perspective, where you could see like the lines and everything and things exploding. It was cool, but I kept wondering, wow, that must have been so expensive.
Yeah. Well, and another hidden expense is flying the different actors to each other's locations to film a scene.
Right. So how would the logistics have looked for that? Because they...
I mean, honestly, I'm not on the production team, but if I were setting it up, I would try to figure out throughout my season how many times like Riley and Kala have to be together, or Riley and Wolfgang, or and then film all of those at once, because you can't keep flying them back and forth.
Right. Yeah.
But that requires a lot of logistic foresight.
Wow.
Yeah. Oh, yeah. I mean, even just, and you think about it for like just one sequence, it just, that's the thing I think that was probably the biggest deterrent for the series going forward, was the cost involved. Because when you really think about it, it's not a special effects kind of show.
Not really.
But it's just really placement in the world, because they used the world stage. That's really where the expense was in the show.
Yeah.
What do we think about the science behind this?
Hey, look, it's the mycelium network again.
Yeah. So from the name, I mean, I'm actually not that familiar with the term, but from the name, I can assume it is based on fungi and the way many fungal organisms are interconnected with each other and share signals.
Yep.
Okay.
It's how Star Trek's Discovery, the ship, pops around the universe.
Oh, okay.
Through a cosmic mycelium network.
All right. So science-wise, I mean, I don't know whether there can be information transfer between two individuals like that, like in Sense8, but if it were possible, as I was watching episode 5 and then 6, I really began to think, is this that big of an advantage, or is this a big vulnerability for the people in the cluster? Because depending on the way the information transfer works and the emotions that are shared, yes, you have access to more knowledge from other people in the cluster and their skills, perhaps. But if you're going to be vulnerable to experiencing all of their suffering and pain when they are undergoing something really bad, I would say that's a very big disadvantage.
Oh yeah, and you see it affecting them, like Leto in the middle of a scene starting crying for no reason.
Right.
Within the internal science of the show, I'll phrase it that way, they actually do describe entire fungi networks communicating amongst a forest, so that like the sequoias know when one sequoia is wounded, divert resources. Again, I'm not saying it's an advantage, but they actually do start to talk about the science in the show and how it works, and based on their forest example, I'm like, okay, but why is it limited to 8? And why is it always 8? That's the piece that annoys me the most, I think, about their science. Because in the forest concept, it's all of the organisms in the forest feel the pain. So why isn't everyone who's a sensate feeling all of the other clusters as well. Like, you know, the they have to make eye contact piece of it. I'm like, okay, that's kind of a trick, but it doesn't explain why they can't like all connect across a global telepathic network.
Right.
You get answers to that later.
Ooh, okay. And there's also, like, Angelica mentions in a dream with Sun that Sun is the future. So I kept thinking, all right, so maybe that we have little clusters now, but what if the end goal is to have all of humanity interconnected at once, like one big hive organism? Maybe. Maybe some people
Yay.
don't really want that. I don't know.
Yay, we're the Borg.
Well, yes and no. That's all I'll say.
Okay,
But
cool.
it is an interesting aspect when we get there.
And something else I liked in this specific episode is the fact that we are not getting, like, Cavius is in another fight, but this time he can't fight with Sun's skills, which I liked because I was kind of expecting for everyone to just, I mean, like, we have to have one person who's good at fighting, so everyone's good at fighting. But no, everyone can rely on their own skills and talents when needed. And sometimes they, like, take the skills from others, but not all the time, which I think was a nice touch.
All right, let's go on to episode 6. This one was the mind-blowing episode because a lot of people did not expect the big orgiastic scene, but I think it's interesting that the Wachowskis chose to unabashedly include this, that if emotions trigger the connection, then surely, you know, and you get a little bit of it like in the first episode with Leto when he suddenly gets horny because you find out Numi and Amanita are having a little fun time together. And so I think it's interesting that the one thing the Wachowskis did not do was shy away from the sexuality of it. And it culminates into this orgiastic moment. And for me, because I have seen the entire series and the movie, it's the turning point in my mind when they begin to more closely associate those connections with emotions. It's when they begin to really go, oh, you know, and I think that's when, like, Leto and Sun's connection, which is the most bizarre connection between the two people because they are so unlike, you know. But I loved, you know, that Leto, you know, has that breakdown moment earlier in the series where he's just screaming because she's going through, you know, cramps and stuff. She's irritable and she's having her moment. And I just love that they could take two desperate characters that have nothing really in common and join them, and they start to learn from each other, you know, how to deal with those differences. I also like how Will and Riley's relationship evolves and how cool it is that Diego is probably one of the coolest partners a police officer could ever have, because most officers would go, dude, you're on your own, you know, kind of thing. But Diego buys into it. And I love that his father is played by Joe Pantoliano. I love Joe Pantoliano. He's one of my favorite character actors. And the fact that he was in Matrix, and, you know, so he has a connection with the Wachowskis. So I like that element, and that how Riley is sort of moving into Will's sphere, and that Diego's along for the ride. He doesn't understand it, but he sees the breadcrumbs that Will shows him over time. And Diego kind of begins to understand there's something big going on here. He doesn't get it, but there's something going on.
So to go back to the question you asked me earlier, it was episode 5, but mostly 6, where I finally identified with a character, and that character's Will, because he's the one who's trying to figure out what the hell is going on. He's the only one who's trying to figure out what's going on, and he's trying really hard. If my world turned upside down like that, I would become Will. I would be trying to figure out what was going on.
Well, go figure. It's a Midwest boy. But you know what's really funny is that you have that and you balance it with Amanita and Numi, with Amanita's mother. And she's like, oh, yes, I've teach classes on this stuff. You know,
I know.
It.
Yeah.
It was so Bay Area. I was dying. Anyways, I loved that episode the most because for me, as I watched the entire thing, I always came back to this episode where, to me, is where it hinges, where the pivot happens, and they begin learning how to really attach to one another. But what I think is interesting at this level is that none of them have questioned if it's happening with the 8 of them in their cluster, as Will explains to Riley, that they don't go, are there other clusters? Who are the other clusters? What's their story?
At this point, Will is starting to get there with Angelica's backstory because he's starting to ask the questions.
Yeah.
Right. And the others, I mean, many of the others are kind of in life or death situations where it's like, well, maybe I'll worry about the science later. So maybe they're not there yet because of that. And it is in this episode where it's explicitly stated that maybe they're in a cluster because they are so different. That's what Amanita's mother says. So it's maybe like they may have to learn from each other or something. So
it's part of the evolution.
Right.
Yeah. I actually really liked the initial scene of the episode where it's Will and Riley at different bars, like Riley's at a pub and Will's at a bar, because you get the scene from so many different angles, and it's one conversation, but with four perspectives, and it's really, really well done. I enjoyed that very much.
And I also like the fact that, with Wolfgang and Kala, again, 2 desperate people that have really nothing in common. She's very, very Indian in that, way that the women live their lives before their marriage, and that, that they're all very, privacy is the big thing with them. And yet you have Wolfgang, who is so European, so German, he's just the complete opposite of her. And yet the connection is there from the moment they see each other. And and I feel bad for Raj because, he's a nice guy, he really is. And I think Kala learns to value that. And I think this is one of the things in the show that I also liked, long view of the show, is that the others in their world, Amanita, Nando, Diego, it becomes a point of your partners, your friends, the people closest to you matter. And because they're going out on a huge limb, they have no idea what's really going on. And yet they're the ones sticking their neck out for their friend, their partner, whatever, in order to do it. So in a way, it kind of shows that found family queer aspect of it, that these people are in your life for good. They're in there for a reason, and I like that aspect of it.
Yeah, for sure. There's also something I liked. I think it's Nomi who says that she's beginning to wonder whether her connection is going to slowly erode her own sense of self. And that's a very interesting avenue to explore because, yes, you are getting all of this information from others. But then what if, there are 7 other minds. And if your own starts to lose prevalence, maybe this is where they should begin to maybe learn to manage and control that. Nomi says, like, maybe we can control this. And if not, will I lose my sense of me-ness?
Yes. Yeah. And I think that's a good part of the show, is that it's that balance that they learn to achieve. And when they finally do achieve that sort of balance, that's when they become the strongest, because they've learned to manage the situation. But it's not without its, pratfalls and tribulations along the way. They do play a big factor in the learning aspect. And I will say, we haven't really had a lot of Whisperers, but he is the biggest danger for them. And we find out more about Whisperers as we go further into it. So he's one to definitely keep an eye on. So,
and the connection itself can be dangerous, I think. Because, for example, like Riley was choking and then Will kind of also lost it. What if he had been driving? Like, that is, I kept thinking about that. Like, what happens then?
Yeah. Yeah. And part of it, I know that you do get an answer in the next few episodes of why Angelica was dealing with drugs in the first episode. There is an explanation that's coming that I liked, because it didn't make the drug use completely recreational. You begin to realize that some of the drug use is for protection, and Whispers is the key to it all. It's really, he's the one that you have to worry about the most, and you begin to find out that's what Angelica was trying to protect herself from, was Whispers. So
Cool.
anyways, well, that's it for this discussion, episodes 4, 5, and 6. Please join us next week when we will do episodes 7, 8, and 9, pushing forward to the end of the season, with the last one being the final week of January. And then Albert and I are going to carry on doing reactions of season 2 through the final movie in the month of February as our first set of reaction videos. So we will do a full version that will be up on our Patreon of reaction. Then I'll have an edited down version for YouTube here on our Rope Podcast channel. So we'll do our ratings at the end of this month for the entire season. So join us next week, and we'll do episodes 6, 7, and 8. Bye now.
Bye-bye.
Now, on to Who Won Our Week.
So what are we on about?
You're going to laugh.
Okay.
So a friend of ours, we were just having dinner and discussing, and there were 6 of us at a table, and the friend pipes up and says, "Oh, there's the show you all have to watch now." We're like, "What?" "It's on Netflix. You all have to watch it right now. Go home and watch the first episode and tell me what you think." Okay. So in the very first episode, Miss Melanie Rose was described as the Mary Poppins of sex rooms. I am talking about How to Build a Sex Room on Netflix. One, we binged the whole thing in 3 days because it's not train wreck captivating, but you can't stop watching.
I
This
know
woman-
what you.
This
I know
woman
what you
is
speak of.
an adorable, older British woman. She's wonderfully just charming, and you could sit and have tea with her. You think of her sitting down with like Jessica Fletcher, but then she pulls like dildos and riding crops out of her bag and says, "Now, what do you think of these?" And one of the people who she helped actually called her the Mary Poppins of sex rooms. Now, as dirty as this show sounds, it has a wonderful message of repairing relationships and helping people rekindle their love again. Full stop. That is what Melanie Rose has built her career on, and that's what the show is about. It is also unabashedly okay with however you choose to express your sexual adventure. How you do it for yourself is a non-issue, and she 100% recognizes that it's not always okay for it to be visible, so she's helped people build like secret doors to get into their sex rooms so the kids don't find out, or a shed in the back corner of the yard so people just don't know. But oh my god.
Yeah,
What a wonderful
love
way
it.
to get what a wonderful way to get through the flu.
I totally get it, because I watch Gogglebox, and they had a several sequences of people in Britain watching it. So yeah, I know of what you speak, and it looked like the cutest goddamn show I'd ever seen. So
It was. Yeah. And thank God it was 100% diverse. I mean, there was two black couples, there was a gay couple, a lesbian couple, and there was a poly family also included, in addition to like an older single woman who was recently divorced and discovering herself again. I mean, some wonderful, wonderful stories. So it wasn't just, the white male, white female in every episode.
Right.
It was this beautiful mix of people. Shot mostly in the Denver area, so the background vistas are stunning as well. But the good use of music, high quality production, and the rooms themselves are gorgeous. They're not just dirty dungeons. She builds luxurious textile, touch, explore, experience rooms.
Excellent. I'm totally down with that.
Yeah, maybe not the HGTV you're going to share with your parents, but still a good watch.
Right. The thing I'm on about this week is the total dumpster fire of the Republicans finding a fucking Speaker of the House and then neutering the fucker as soon as he takes the gavel. It's just, oh my word.
Have you seen the meme going around?
Just,
the RuPaul meme? Have you seen the RuPaul meme going around?
No, I haven't seen that.
It's Ru and the judges, and the words across the top are, I'm paraphrasing, it's along the lines of, and this year's winner of RuPaul's Drag Race will get $100,000 and be crowned Queen of the House of Representatives.
That's excellent.
It's really funny.
It was such a major shit show. And what I love the most about it, although I feel for them, was the children that were there every fucking night thinking this was the night their parent was going to be sworn in. Mm-hmm. And by the time it got to like the evening when they finally did it, I saw only a couple kids and they were like, oh, thank God this is over.
Yep.
Yeah, that was the biggest shit show. And it's just beginning, kids. We've got 2 years of this asinine assholery going on. I don't know. Yeah, I'm worried about our future for the next 2 years. It's just going to be. The only thing I can say is I hope the media doesn't give them a lot of air.
That'd be nice.
They will, but I hope they won't.
Right.
So who won your week?
There is. Let me pull the story over here. A Dutch company called Lightyear that has officially started assembly of electric vehicles that run primarily on solar power. Taking advantage of the body space with all of the curved solar arrays, blah, 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 it can yield 40 miles of free range per day from the sun alone.
Cool.
So for most people who are to work and back or to grocery store and back, that's never paying for fuel or electricity for your vehicle again. So watch the company called Lightyear for the release of that vehicle.
Yeah, that's right up there with Aptera, who's here in San Diego. And they've just released their production car. So it's now being produced. I think it's going into production like in the next month or so. So they'll start producing them and putting them out on the road. I expect we'll probably see several of them here in San Diego before they start to make their way across the country. But it's the same thing. They've got an option. Yeah. But it's just they're covered with solar panels. So even when the car's parked, it's charging. You don't have to plug it in. There is a plug that you can plug it in if you need to.
Same thing with these.
But there's no reason to really do it. And so I'm looking forward to this new avenue of doing these cars and stuff. So,
and I mean, the argument that's selling my family on this concept is getting America off of foreign oil.
Oh yeah.
That's what's,
or just oil, period.
Oil, period. But for some family members, it's the concept of getting off of the foreign oil that's winning the argument. So I share this with the world. If you have family members who are resistant to the concept of electric vehicle, drop that little bombshell on them.
Mm-hmm. Amen. So my who won the week is actually quite charming. It is the actor Noah Schnapp, who plays Will Byers in Stranger Things. And he very quietly put out a clip of him playing Will Byers. And he said, gee, I think I have more in common with Will than I thought. And the internet just lost their shit. He's had tons of love poured his way. It was his coming out. It was just this quiet little thing he put out there, and people were ecstatic. So, and I guess he finally told his friends and family, and their response was, we know. I love that it was a letdown.
I mean, I love that it was a non-issue. I don't want it to be a letdown.
Yeah, well, yeah. I mean, well, you gear yourself up for this big moment, and then you get, we know. It's like, oh, girl, catch up. But it just, I think it's nice, and it's something I should have mentioned with Brian J. Smith in our discussion of Sense8, because Brian J. Smith went through the same sort of thing. It wasn't until he played this character of Will Gorski that he began to really allow himself to step into his own truth. And and I think that sometimes these actors who are trying to play by rules that don't really apply to them, and they struggle with it, and then coming to terms with who they are because of characters they play, I think that's a rewarding way of discovering yourself, is by stepping into the shoes of another and then going, oh wait, maybe it's not so bad, maybe I can do this, kind of thing.
Or
so
maybe there was a reason I gravitated toward this role.
Yeah. And just to see Noah, have his moment, and just the quiet way he did it was so Will Byers. It was so Will Byers to just put it out there very quietly, and then just let the internet explode with, all the love. So my hat's off to him. Welcome to the family, my boy.
Nice. All right.
So that's it for this week.
Any words of wisdom for folks?
Stay healthy. Vance and I are both dealing with the yuck as we record this. Yeah. So stay healthy. That's all we're saying. Please do what you can.
All right, Written on the Edges, produced by Rogue Ravens Media. For our disclaimers, links to social media, our listen stations, or to sign up as a guest, visit www.rotepodcast.com. If you enjoy learning about new artists, please like and subscribe so you get the alerts for new episodes. You can follow us as an audio podcast. You can follow us on YouTube. There's probably more on YouTube to see than to listen to in the audio podcast these days, so I kind of recommend you go that way. But tune in either way. Come back next week for your queer media fix. Bye-bye.
Bye-bye.
Oh, what's that? Closing time. The bums rush in melody, dear.